I'm joined now by David Shipp, who is speaking at this year's CI 2016. Now, what exactly will you be talking about?
Well, for this year's presentation, I will be speaking to what we call the qualitative benefits of cochlear implantation for people that are undergoing what we call hearing preservation surgery. So these are patients who have a reasonable level of residual hearing but still need a cochlear implant in order to hear properly. And they're a little different than our standard, more traditional cochlear implant candidates. So we're looking to see what kinds of benefits they get above and beyond the hearing testing results.
CI candidates must come to you with a range of questions. Are there certain things that you wish that they'd ask that they often don't or kind of miss?
Well, sometimes it's almost the other way around. Sometimes they ask things, in fact, usually they ask things that we really can't answer honestly. The most common ones being, how well will I hear after the implant?
Right.
Will I have pain? How long is it going to take me to achieve whatever goal I happen to have? And those are things that you can only answer in a very general way. You can't be specific to that individual necessarily.
I imagine everyone's progress is different.
Yes.
And sometimes it can go one way or the other.
Correct. Some people adapt to the implant very quickly and start achieving very excellent results very early in their after surgery period. Others, it takes weeks, months, sometimes even years.
I see. What would you say are the most exciting topics right now being discussed at CI 2016?
I would say the most exciting topics for this meeting and at some other meetings more recently are the future of cochlear implants, which I think include the ability to use the implant electrode to not only stimulate the electrically so somebody can hear, but it will also elude certain kinds of medications that can help preserve some of the neural elements inside the cochlea and that may promote things such as hair cell regeneration, things along those lines.
When do electrode arrays come into play, and what are the benefits to a longer one or a shorter one?
Well, our program has always had the notion that it's important that electrode arrays be at least on the long side, I'll put it that way. In the early days of hearing preservation surgery, there were some attempts where electrodes that were very short were put into the cochlea. The rationale being is that maybe that's the area of the cochlea that really only needs the electrical stimulation, and if you put it in deeper, you might damage some of the natural hearing that's there. But in our case, we've always felt that it's important to have longer electrodes because a couple of things could well happen. One of them is that they may lose hearing during the hearing preservation procedure. If that's the case, you want to be able to stimulate the areas where the low frequencies are processed. And then also too, then you have what I know that one of the companies that we deal with, MED-EL, calls complete cochlear coverage. So again, that way you're able to cover the entirety of what's needed in order to stimulate properly.
Well, thanks for sitting down with us and clearing some of this up for us. Threw a range of topics at you, and you handled it very well.
Well, thank you very much.
Enjoy the rest of CI 2016.
And thank you for having me.
Thank you.